y arriver. Alors, bonjour et bienvenue.
So hello and welcome to this press conference from Premier François Legault, together with the Minister of Health and Social Services, Daniel McCann, and the National Director of Public Health of Quebec, Dr. Horatio Arruda. Yes, hello everyone. First, I wish to tell you that the mask that I'm wearing today was made by Ms. Madeleine Lebel and Paulette Vallée from the Cercle des Fermières at Saint-Monique-les-Saules here in Quebec. So once again, I invite you, first, when you leave your house, to put on a mask, and if you are able, to buy a mask that is made in Quebec. Numbers of the day. 51 deaths have been reported, a total of 3,647. My condolences to the families and loved ones of the victims. We now have 44,197 confirmed cases, an increase of 570. And we have to take into account that there's at least 12,500 of those who are cured out of those over 44,000. 1,784 people hospitalized, an increase of 13, and an increase of 1 person in intensive care. So generally speaking, this is good news. First, the lowest total of new cases since the 11th of April. The situation in hospitals continues being stable, and the number of deaths is continuing going down compared to the preceding weeks. Another good news, yesterday we had 145 employees who came back to work in the network. So things continue improving, but it is important to say there's still a lot of work to be done. Most of the positions are filled. So when we hear about Je contribue, most of the positions are filled. However, and it is important to say this, there are 10,000 people who were hired through Je contribue, and we have 1,000 soldiers. So as we can see, there are a lot of employees who don't have all the usual qualifications that we require. So it remains very difficult in the health network. And I wish to say a few words on the FIC union. Earlier on, in front of our offices, the FIC, the nurses' union, made a protest, and of course, that disappoints me. The main claim is to increase the ratios, to increase the number of nurses. What has to be understood is that since we've been at the government for a year and a half, we have increased a lot of positions at pretty much every level, orderlies, nurses, etc. But unfortunately, a lot of those positions have remained unfilled. So it's rather theoretical to say we have to increase the number of positions even more when the positions that already are posted are not filled. So I understand that there is that claim and that it is something that has been demanded for a long time, but I think that it has to be recognized that we've increased the positions by quite a bit, and they're not being filled. So how can we fill them? Well, the first thing, we have to permanently increase the wages of orderlies. I think it's pretty simple to understand that if tomorrow morning we have more qualified orderlies, that will give relief to the nurses and a part of their workload. And another thing that we try to do with the temporary premiums, and we are open to discuss having them incorporated permanently, is to encourage people to work full-time. When we think about that, there isn't a single private or public organization that could work the way that we're doing it right now, with half of the workers who are part-timers. So I think that we really have to find financial incentives so that full-time positions, including the evening, night, and weekend positions, be filled. So we keep coming back to the question of wage increases that have to be differentiated. I mean, it also makes sense to say we should increase more the positions of those who are unfilled than those who are filled already. And I just wish to say to the nurses, I am very conscious of the fact that the working conditions are difficult. We can't work with 10,000 new employees who aren't necessarily qualified and thousands of unfilled positions, 10,000 people from the network who are on leave, whether it be sick leave or others. It is clear that for the remaining nurses, it is very difficult. What I would wish is that we work together at the table, trying to create incentives to draw and fill those positions. We are open to talk about the ratios. So before adding people, well, rather, let's start by filling the positions that we have announced and that we have been announcing for the past year and a half. We took the commitment during the electoral campaign to increase the budgets in CHSLDs, in home care, pretty much everywhere in the health network. We did so. But unfortunately, a lot of positions have remained unfilled. A lot of them orderlies, and too many of those positions are part-time. So I'm calling out to the Union of the Nurses, the FIQ, to try to find together solutions so that our network functions, so that the working conditions be less difficult for nurses, and I think that it should be done at the table rather than in protests in front of my offices. I would like to conclude on the situation, the number of cases, the number of deaths, the number of hospitalizations. We can see we are slowly taking control over the virus, but we haven't won yet. And that is important to repeat. The virus, COVID-19, is still there. The virus is going around. And not just in Montreal, everywhere in Quebec it is running around, so it's important to protect ourselves. And yes, we are happy to gradually deconfine. But if the virus starts spreading again, since it is still roaming around, well, we're going to have to put Quebec back on pause, and we don't wish that. Anyone. And in order to avoid it happening, we have to respect the guidelines. So stay 2 meters away from other people, 6 feet, put on a mask, amongst others, when you take public transportation, when you go to businesses, and I'm not just talking about Montreal here, everywhere in Quebec. So put on the mask when you end up in a public place where there are many people. My daily thanks, well, it's the National Day of Orderlies. I was saying it earlier on, it's been a long time that we have tried to increase the wages of orderlies, and on top of that, the orderlies work in very difficult conditions because there's a lot of unfilled positions, 10,000 people who don't necessarily have all the training to be able to work right now in the health network, but who still are there to help, and I wish to thank them. But I still want to say how much admiration I have for orderlies. This is a position which for too long has been undervalued. We have to find a way of better paying these people. We have to find a way to make sure that in our society, orderlies are seen as being people who do important work with those amongst us who are vulnerable and who need them. So I want to take advantage of this day to thank all orderlies, and I think that the best way to thank them is to follow the guidelines. It's a question of respect. There are people who work really hard in the health network. It is not time to go and send people in hospitals uselessly just because you didn't respect guidelines. We have to play as a team. And as we say in hockey, it is not time to get a silly penalty that results in losing the game. So we have to make sure that everybody follows the guidelines, and I count on Quebecers. We are able to really support one another and support those who are in the health network. Thank you.
Good afternoon. The situation remains stable in our hospitals. The number of deaths continue to be lower than the last few weeks, and we have the lowest number of new cases since April the 11th. So it's encouraging, but it's no time to let our guard down. The virus is still there, not only in Montreal, and we must continue to protect ourselves and to protect others. If the contagion restarts, we'll have to put the brakes on the reopening and put Quebec back on pause. The best way to stop the contagion is to respect public health instruction. I ask you to wear a mask in public, particularly in public transports and shops. We must also continue to keep our distances. We're going in the right direction, but now it's not the time to stop all our efforts. I'm counting on you all. Thank you.
Nous en sommes maintenant à la période de questions.
We will now start with the question period. My question is for Mr. Arruda. We are preparing to deconfine the commercial sector of Montreal. It's been about 2 weeks since it was done elsewhere in Quebec. What do we know on the impact that deconfinement had for the commercial sector outside of Montreal on cases and on contamination? Well, things are going well. It is clear that deconfining brings about a greater risk of the virus being transmitted. We're expecting that. But there's been no situation that would allow us to say that it was out of control. We remember that there was an outbreak in a meat processing plant, but it was put under control. And there were a few cases, I would say, that appeared in certain daycare centers, but without any impact or significant impact on health. So right now, the deconfinement outside of the MMC is taking place the way that we expected it to, because it's clear that deconfining automatically means a certain transmission, but we hadn't had any important outbreak other than what we had expected as such, and we also did not have any situation that went out of control. So that is adequate. It is important, however, even in the regions, in cold regions, to respect the guidelines, because the less there is distancing, the more there are contacts, the greater the risks. The other element as well is, particularly in the Montreal region, since we know that the situation is a lot more fragile and that there are hot transmission zones, that is why we are delaying things to know how we can keep control over those situations in the Montreal area. Thank you. A question from Mr. Legault concerning the bargaining with the unions on the wages of orderlies. It's been weeks that you've been saying that the unions refuse coming to an agreement that would be just for the wages of orderlies, but all signs show that it's mainly the president of the board. There's a tweet in which where he wrote that there will be no wages, no agreement on the orderly wages without a global agreement with all of the public sector employees. That's the president of the Treasury Board. So how do you justify that? Well, first, good news, and it's a step in the right direction. You probably saw, as I did, that the FTQ is accepting the increase of 12% for orderlies. That is the positive aspect of the news. The bad aspect is that they continue requiring that there be a domino effect on other positions, and that is where we have the problem, is that basically what we want are differentiated offers. So we want to be able that there not be as much of an impact on the other positions, unlike what the unions are asking for. So we're really talking about differentiated offers. But I'm happy, at least, that the FTQ says we agree with that 12% for orderlies. But we have to also be able to, all the question of the other parts of the agreement, have to follow.
Bonjour à vous trois. On a vu
We have seen that there are more tests, but not more cases, unlike what perhaps you had expected. So is that just good news, or do we question ourselves on the screening strategy? I think that it's too early to be able to make any conclusion. I think that we are continuing the operation of testing people in CHSLDs and particularly also healthcare workers. It also shows that there's a good proportion of tests that was done, despite the fact that we had the impression that it was not everybody who had been tested. There was a good proportion. There's also sometimes lowering in the number of tests that are done over the weekend, especially long weekend. So I think it's a little too early. Of course, we can have a decrease in the curve on the one hand, for example, transmission CHSLDs, and we could have a community transmission that would balance that out. So it's too early. We have to have more detailed analyses, and that is something that we'll be able to do with the regions. So what is good is that we're not seeing an increase, but at any rate, I'm telling you as well that we can see the effects of deconfinement, where we can see the effects of hospitalization rates. That's something that we'll see only 15 days later. That's why we're prudent and we're asking people to collaborate. You know, it's like, oh, it's very, very nice. The deaths are decreasing, but I want them to keep going further down. But we keep a close eye on that from one day to the next. And as the Premier said, we've announced the dates, and if and we will continue reevaluating the situation. And if things don't go well, we're just going to have to step back again. But I would like, as the Premier said, that people listen to the guidelines so that we don't have to go back. And I can tell you, and for that, it truly is, we're no longer on pause. We are in reopening, but we are not slackening of social distancing, physical distancing. We have to maintain, the measures of respiratory etiquette, the hygiene, and everything else. Madam Minister, what do you say about the involvement of doctors in CHSLDs now that surgeries, elective ones, are starting again? I understand that there's fewer of those doctors, but how many were there, and was it positive or was it a failure? No, I think that it's positive. I think that we had, from what I recall, 2,000 specialists and 1,000 general practitioners altogether, but of course it wasn't full-time work. It's people who came for maybe one shift. I think most of the time it was part-time, but listen, it helped us. Certainly it helped us. We still have about 100 per day who come and help us out. And in fact, the activities, as you said, are starting up again in hospitals like surgery. So there's a lot that have gone back. But I believe that in the period where they came and helped us, it really made a difference. It really did. A question from Mathieu Dion. Could you give me a timeline as far as the reopening of personal care like dentists, camping, restaurants, shopping malls, and office buildings, because not everybody can work at home and people are asking themselves questions. Can you give us an idea? Well, just to say, first of all, in the course of the next few days, and I hope this week, we'll be able to announce news for services, hairdressers, massage therapists, day camps, gatherings. I'm asking you to be patient. We are working on that, and we should be able to make an announcement in the next few days. A question on the Quebec Experience program. Is it going to go through a higher requirement in terms of a higher number of years of experience, and why is it necessary to work this way? We are still analyzing the PQ, so the file is not yet even at the Ministers' Council. So we have a lot of scenarios that are being studied. Of course, we wish to have foreign students. And concerning immigration, generally speaking, for next year, we're not excluding that we will reduce the thresholds.
Bonjour à vous, Monsieur le Premier ministre, Madame McCann, Cher Ouda. Madame Minister, a service note is circulating in Laval from the 15th of May, where it is said that people can, and you said it like 50 times, can go from a cold zone to a hot zone. There's even somebody who refused to say it because the union said, no, I'm not going to go from a hot zone to a cold zone. What are you going to do to make that message be understood? Yes, I'm aware of the situation. I am going to try to be pretty clear, as
clear as possible because it's that simple. First, it is true that I've always repeated it, I'm repeating it once again, that in CHSLDs, there has to be designated teams. So people who work in hot zones only and other teams that work in cold zones only. In CHSLDs, it is fundamental. We have more restrained spaces there and people who are very vulnerable, and we know that. So that remains an orientation that has to be applied everywhere in CHSLDs. In a hospital setting, it's different. And the memo that you talked about is a specific sector, nanopathology and pediatrics. But what I want to say about the hospital sector is that the situation is a little bit different. It is clear that in the same day, you cannot go from a hot zone to a cold zone. That is prohibited. However, when we come back the next day, after, of course, having changed your clothes, having showered, having been completely cleaned, you can come back to a cold zone, but with all the protective equipment as well. And we know that in hospital settings, people are very used to this. The material for protection, you know, the visor, the gown, the gloves, the mask, and it's everywhere now in the hospital sector. All of the protective material has to be worn in both hot zones and cold zones. The same day, one can never go from a hot zone to a cold zone. The opposite, however, to go from a cold zone to a hot zone in the same day, for example, there's overtime, that can happen. But the reverse, going from a hot zone to a cold zone, is completely prohibited when it takes place in the same day. I don't know if it's clear enough. But it is quite a gymnastic. You know, it's very important in terms of infection prevention. And you can see that I am making a difference here between CHSLDs and the hospital sector.
Restons dans le secteur hospitalier. Vous avez annoncé hier une reprise graduelle.
Let's stay in the hospital sector. You talked about 40% and for more surgeries, 70% for medium zones, and 100% elsewhere. Do you have the necessary equipment to make sure that there is a 100% resumption of surgeries? Yes, I think that the equipment, we have resolved a lot of the problems that we had at the beginning with procurement. And we can also, as far as the medication is concerned as well, because we also had that issue, and it has fixed itself, but it is not a situation. I mean, we have to follow it very rigorously. We've also brought changes in our processes, and it allows me also to say that for Montreal, although I said the Greater Montreal area that it was at 40% for the time being, what we wish with the evolution of things, more available staff, for example, but also agreements with private clinics and specialized medical centers, lengthen working hours, weekends, evenings. So with those strategies, perhaps, you know, operating people in other regions as well, we hope that we're going to go beyond the 40%, of course. So what we're saying is that right now we have the capacity for 40%, but with other strategies, we want to go further. And we will have more specific data at the end of the week, and I'll be able to talk to you about it again on Monday, probably, on the plans of the different establishments to resume with surgeries.
Bonjour, Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Il semble y avoir des statistiques.
It seems that there are interesting statistics. Yesterday was 34 deaths. Today it's 51. Of course, it's regrettable, but it's not as high as what we've experienced in the past few weeks. Today, the number of new cases is going down as well. What about the situation in CHSLDs? In the Montreal region, amongst other places, is there also an improvement here? Are the cases less significant? What can you tell us about this critical situation? I can tell you, generally speaking, that the number of CHSLDs that have more than 15% of people who are infected has decreased by quite a bit. So that is encouraging. However, there are new CHSLDs that have a few cases. So CHSLDs that have newly become infected. So the situation, from a certain point of view, is going better and others not so much. There's still work to be done. I don't know, Daniel, if you wanted to add anything. Yes, and we are doing a considerable amount of work as far as infection prevention is concerned, which is going to be translated by a substantial plan for practices in infection prevention in CHSLDs, for that to stay, for the future. We are going to give CHSLDs the means to install even stronger infection practices. It's ongoing right now, establishing these, and we have more staff that is taking care of infection prevention. We're putting back staff that unfortunately had been cut in the preceding years. Nurses in infection prevention, we even have the Red Cross helping us on that, and advisors as well. Nursing sciences advisors. So truly a complete plan in infection prevention that is going to stay. It's going to be permanent in CHSLDs, and it is being implemented as we speak. I find it important as well to mention that this is a malicious virus. It's still present in Quebec. It has not disappeared. And I think that we really have to understand that even in cold zones, it is important to respect the guidelines of distancing and etc. We will have cases of elderly people who live at home. We will have cases of people who live in residences for the elderly. We hope that we don't have cases in quantities like an RPA or a CHSLD, that all units be affected. But it is very important that you understand that this virus could come from one of your own children who doesn't know that they're infected and who perhaps will come and not do distancing. So if you are at risk, if you have chronic diseases, it's even more important to respect the guidelines because it is in the community. It hasn't disappeared. The virus is there. It's malicious. It comes into your home and you don't know, and you're already contaminating other people. I don't want to scare people, but I want us to be conscious of that because the problem in CHSLDs was very significant. We had a lot of problems, and what we want to avoid is that this becomes repeated in other areas. And even if you are at home and you have chronic diseases or you're older, if you don't respect the guidelines, you could be one of those unfortunate extra deaths. And I would also like to add, that we are adding staff, of course. So that is also, those are also things that will remain for the future. So we want for the situation to improve, and we will also continue working, to keep people at home, because as Dr. Arruda is saying, that is the other place where we have to be extremely prudent and have rigorous practices. I also wish to mention the presence of family doctors. Family doctors in CHSLDs at home, and it is the International Family Doctors Day, such as it is the International Day of Respiratory Therapists and Orderlies. And family doctors are fundamental in CHSLDs and to keep people at home. So these are things that we want to reinforce as of now. We're already working on that, and when things keep unfolding. Have you evaluated the impact that this will have on the health budget, all the measures that will be staying? And I'm not talking about what you've spent in the emergency situation, but now you're saying, we're going to implement new practices for prevention. There's going to be more of what we understand to be staff in CHSLDs and hospitals as well, in an attempt to bring back situations that we've realized were not normal. What will be the impact of those increases on the health minister's budget? Are you able to evaluate it right now? The measures that are going to stay, I mean. Well, first, in the measures that were set up, there's about $3 billion. The vast majority are measures that are non-recurrent. However, I said so, we want to make a reform in CHSLDs where there will be recurring expenses that will be added. We also have to remember that for the past year and a half, we have increased significantly the health budget, whether it be care at home or CHSLDs or in hospitals. However, a great part of those budgets were never spent. So I'd like to come back to what I was saying earlier on. Despite the budget efforts that we've made, we ended up on the 1st of March at the end of the year with a lot of unspent money because the positions were not filled. So, of course, if already, and it's pretty funny to say that, but if we were able to spend that money that we wanted to spend in health, well, already we would have thousands of extra positions in the health network. But the big challenge here that we're having is to fill those positions. So, first, we need better wages for orderlies. But as I was saying earlier on, of course, if there are more orderlies, it makes working conditions easier for nurses. So it makes the positions of nurses more attractive as well. Because right now it isn't too attractive to go into the health network because there's fewer people doing the work that should be done by more people, so they work more and harder. So it becomes a vicious circle because we don't have enough people, because there aren't filled positions. So the work is even more difficult. If you allow me, Mr. Premier, we look forward to seeing, the full-time premium that was implemented. We should have news about that at the end of the week to know what the impact it was, because over 50%, inaudible question. For the time being, we want to see the impact, and then we'll see what we'll do after. We're going to have an agreement with the union. Yes, we have to have an agreement with the union, but we also want to know whether people were drawn in by that, because it's over 50% of our labor force which is working part-time. So if a part of them start working full-time, that's going to help us out a lot. So we should know more about that at the beginning of next week. Hello, Mr. Premier. Your counterpart in Ontario announced that he was going to start an investigative commission on long-term health care centres in his province. Are you open to doing the same thing here in Quebec? Yes, absolutely, and I've already said so. What I'm noting is Doug Ford announced an inquiry that would not be public, and it would start only in September. We are thinking, once we are back, once we have control of the crisis again, so after the crisis, nothing is being included. We are going to find a way of going to see what is going to happen, but without wasting time, because there are solutions that we already know and that we want to apply in the next few months. Now, there are still CHSLDs where there are outbreaks of COVID-19. It's been a few weeks already that we know that there are protective measures that should be taken to avoid viruses arriving in CHSLDs. Have you identified the origin of the new outbreaks in CHSLDs, those that are being added to the list? Well, there's always an analysis that is done by public health and by the team in public health. What we see is that after 2 months, the teams know what to do when there's an outbreak. But we have to see the origin, of course. That is very important. But as soon as it happens, we know what to do. So we set up the measures, and it has an effect of stopping and containing the spread, because we know what to do quickly. So, of course, we have to analyze what happened, and these can be different sources from one situation to another. Dr. Arruda? We could look at it like in the case of influenza as well. It can be visitors. That could be the source because it's circulating in the community. It could be a healthcare worker who is asymptomatic but who is going to be developing symptoms. So is it an environment that is semi-closed but not entirely closed? So there are interactions that can take place. Or it could be because a patient went outside to go get other kinds of care and got infected and is in incubation period. So all of that, it can be a mix. What we know know in terms of general dynamic is that the first wave is associated to people who traveled, who were asymptomatic, who came back, went to work, etc., and people who went from one center to another because they were working for agencies and they were infected, no symptoms, and they transmitted the disease. And right now, I would say that it could be from different sources. Of course, right now, taking into account that we have fixed the question of capacity much better, not entirely still, but much better, not to have to deal with agencies, etc., without it being totally possible sometimes. Well, we are able to go further. So there will be cases in CHSLDs, but what is important is to curb them as quickly as possible and to set up these practices. And that is why dedicated teams are going to play a major role, what we call PCIs. So I think that it would be difficult that it never makes it into CHSLDs. What we have to avoid is that it goes in and that within 3 days we have 800 cases. Okay, 800, I'm exaggerating, but that is where we have to look at the trend, because what we realize, for example, today, there are fewer infected workers, and I hope that this will continue, because the fundamental element in all that is training. It is not simple. Infection prevention is not something simple. How to put on the protective equipment, how to remove it, at what moment. It is quite the operation, and we have to try as much as possible to reach for perfection, but of course we never succeed. So there will probably be a few outbreaks still. We want them to be as few as possible and that everybody be trained 100%. And if you allow me, Madam Minister, I'm sorry, Madam Minister. I didn't mean to say Miss Madam Premier. I'm sorry. I saw both of them, and the two words mixed up. I meant Madam Minister. So when healthcare workers, if we don't respect the guidelines, when they get home, they can also catch the disease from the community. And I'm sorry. My apologies, Mr. Premier of Quebec. Not offended, don't worry. If you'll allow me a question as well, to get back to the question of the bargaining in the public sector, the FTQ has filed an offer. We talked about it earlier on, 2% per year for 3 years, with a 12% increase for orderlies. We realize that it really is not far from the offer that you yourself filed, 75, 1.5, I think, 0.75. What are you missing to sign? To say yes to this offer? Well, I was saying it earlier on. It is the impact of the increase of 12% of orderlies on the other positions. That is where there's still discussions being done. As well, you touched earlier on upon the dates of deconfinement for certain professions, hairdressers, etc. You said yesterday that you had a meeting in the evening to have a calendar with specific teams, team sports, gatherings. Did that take place with public health for approval first? And did you get to a specific calendar of some sort? The meeting did take place. There's still discussions that have to be held. And what I was saying earlier on is that over the next 3 days, we should be able to show you that plan. Mr. Premier, as you were mentioning earlier on, it is the Day of Orderlies. I was wondering, are you planning on something to honor them? Those who died during the pandemic, symbolically, and also could we help out those workers or the people who survived and their family members? I did ask how we could pay tribute to all the people who have died, including those employees of the health network who have died. So that is being analyzed right now. So you can say that we paid tribute and also put the flag at half-mast last Wednesday with the support of all opposition leaders and parties. So we're looking at what could be done to to honor all those people. And in terms of compensation for those people, I'm not aware of that part. And on immigration thresholds, would you give an idea of the size of how the lowering, is it the 40,000, the symbolic number? It's still too early to say exactly. First, we'd have to see. First, there's no question of changing the thresholds for 2020. That's the first thing. As far as 2021, well, the first question to ask ourselves is, what will be the unemployment rate in 2021? It's difficult to have a precise answer to that. So we are going to first have the maximum number of specialists who will be able to answer that question, and then we'll adjust, we'll have discussions with the federal government.
Mais non, excusez, parce que là, on peut pas relancer tout le temps les questions. On s'en demande une certaine discipline.
We need some discipline for the questions, please. You can't keep on. We are now entering the English question period.
Good day. Hope I don't get in trouble. You mentioned there's been a new flare-up in a CHSLD. Can you give us more details on where this case has happened? I know Madame McCann just said that the teams are better trained and can better get on top of the cases if it happens, but can you give us more information about where this situation emerged?
It happened recently in two long-term facilities in the Quebec area.
City area?
Quebec City area. So I've had a report on this, and again, as I mentioned in French, the teams are very well trained now to stop the propagation. So all the measures have been taken.
Were there deaths or any more information?
I don't have, the specific because it's very, very recent. So I cannot be specific on that.
And Mr. Legault and Mr. Arruda, you both you said that we have to be careful. We don't want to take a bad penalty in the hockey game. What is your assessment of the situation in Montreal today? Is in terms of community transmission, is it under control, and how is Montreal doing?
I think that the indicators of Montreal are going down, slowly going down. The situation is under control. There is, I would say, active transmission, especially in certain sectors of Montreal. It's not under, I cannot say that we didn't lose the control, but the situation is very fragile. So it's why any heading on the situation can put that overflow and that being a problem for our capacity or healthcare or even public health to do investigation. So it's why, even if we are opening things, controlling opening things, there is a sequence, there is phases that are going to be done, but it's important to respect them, Even when we say, and with good time, good weather, it's clear we all have enough of COVID-19. We all would like to go back to the way we did it before. But that's not the time, because if we do that, we're going to lose the battle altogether. And that will mean that we will have to come back, confining again, making in posts. So I think that's not a good news. So it's why, please, listen, and don't think because we open one sector that it means that your sector is not open, you can do it by yourself.
Add to my answer just previously, there was also, I knew I was forgetting one in Montreal, in the west part of the island in Côte-Saint-Luc, but the situation is under control. It's on a particular floor. There are no deaths reported. People have been tested, and all the measures are taken. So I wanted to mention that to you also.
Maintenant, question pour Cathy CBC.
Good afternoon. Ontario, as you know, has ordered an independent commission into long-term care after more than 1,400 COVID-19 case-linked deaths. As the Premier, who was going through the crisis, how important it is for you to give residents and loved ones a voice the answers and the change they deserve, and an independent commission would fit your expectations, or you want more?
Okay. At this point, we haven't taken the decision, but like I've said before, we don't exclude a commission. Which form will it take? We know already that in Ontario, it's not a public commission. We already we don't know the people that will be part of this commission. We know that the commission won't start before September. So I think it's better for me to take few additional weeks, take the right decision, and have an announcement that would put all the details on the table. But at this point, we don't exclude that. Of course, I would like to know exactly what happened and what are the solutions, the changes we need to make in order to make sure that it doesn't happen anymore.
Okay. My second question is about Redmonds.
Yeah.
After Aldo, sorry?
Redmonds.
Oh, sorry. I'm sorry about the pronunciation.
Accent,
Redmonds.
That's all right.
You had Aldo a
Yeah.
few days
Yeah.
ago. I guess I'm all right with Aldo. So, you know that Redmonds is seeking protection under the Companies Creditors Arrangement Act. And this plan is necessary because of the COVID-19. And the CEO was saying that it's the most difficult decision we had to take for our organization after like a history of more than 100 years. How do you relate to this?
Okay.
Like, how do you react personally as a former businessman?
Yeah. I had a meeting yesterday afternoon with Pierre Fitzgibbon, talking about the retail business. It's not easy because first you have the federal government. You also have the owners of the different buildings. Some are nice and they understand the situation and they are not too tough requiring the rents to be paid. Some are not, or not as much. And it's a very tough situation. And I can understand that it's very tough for these companies, for these entrepreneurs. And we have to find a way to help them in a bright way, in order to make sure that as many as possible will reopen. But in certain cases, we also have to deal with the owners of the fixed assets. So we're working on that. I hope in the next few weeks that we'll be able to announce something. But Pierre Fitzgibbon is working very hard to make sure that as many retailers as possible, including large chains like Redmonds, yeah. So, yeah, we want this institution to survive for sure. Yeah. Peut-être le dire en français. J'ai eu une rencontre.
Maybe I'll say it in French. I had an evening meeting yesterday with the Minister of Economy, Peter Fitzgibbon, to discuss, amongst other things, of the situation in the world of retail. And there are many issues that are not easy to set up together. First is the contribution of the federal government, and there is also the place of the owners of buildings and malls who didn't all have the same reaction following the crisis that we are going through right now. So we, of course, want for as many people as retail stores as possible to be able to reopen, especially since we're talking about reopening on the 25th of May, and we hope very soon in malls. There is also the basic trend on online sales. It's possible that online sales will go from 10 to 20 to 30%. So in total, that there'd be fewer needs for retail space. So we have to try to put all of that together make the best decisions possible. Of course, there's the big chains and the little regional stores in certain cases. So each case is different, and we're trying to see how to set up a program that would be complementary to what is being done by the federal government.
Hi. Canada and the U.S. have agreed to prolong their deal to keep the border closed for another month. Are you satisfied with this decision, and would you like it to be longer than a month?
Okay, first, I'm very happy. It was a request I made at meeting with Mr. Trudeau a few times in the last few weeks, so I'm happy that we'll have at least another month of closing of the borders. I would like, yes, that we go through at least another month after in July. I think that until we really have the control, the last thing we want is to have, for example, people of New York coming to Montreal and restart the virus in Montreal. So I'm happy about this additional month in June, but I would like to have another one in July.
Okay. And on another subject, les Sœurs de la Providence, they say they are losing staff because they make more in the public system. Will you consider compensating them for the mandated salary increase?
It's part of the analysis we're making. We understand very correctly that when you increase the salaries in the public sector, that it has an impact in the private sector, including for the congregation. So we're looking at that. We have started making analysis, evaluation of how much it would mean to help the private sector, but we're working on that.
Maintenant, les deux dernières questions en anglais de Raquel Fletcher, Global. Since schools was officially canceled, parents are reporting to us that they suddenly have a lot of work to catch up on before the end of the year. Did you start too late to give guidelines that parents and teachers need to follow?
I don't think so. I think we've put in place some work, some homework for the students. Of course, the challenges we had in the last 2 months was that some of the teachers, they themselves had children at home, and they weren't all, they didn't have all the time to help their regular students. So now with the opening of the care center for the children, the daycare centers will have more opportunity to make sure that all teachers are available to have a follow-up with the students that are at home.
And now the last question. Can you please repeat in English what you said about the FIC protest this morning? You did not appreciate their protesting. Why?
Yeah. Well, first, we know that the main demand of the union of the nurses is about the ratio. So what it means the number of nurses in each CHSLD or hospital. We know very well that since a year and a half, we had large increases in budgets, large increases in the number of posted jobs. But unfortunately, the jobs were not filled for many reasons. One of the reasons is about the salary. And the other one also is that, unfortunately, some workers, they prefer to work part-time than to work full-time. And we have to find solutions for that, because we cannot have 50% of the workers being part-time. So before requesting better ratios, which means more nurses, it's important that we fill the jobs that are open already. So that's what I'm telling the union. I would like to discuss with them. I think we can find some common goals, common solutions. I don't think it's the time to be on the street in front of my office.
C'est tout. Merci beaucoup pour votre collaboration.
That's all. Thank you very much.